Welcome back, COM103. We're doing the lab for community pharmacy practice. Comprehensive practice, starting on page 169. They're giving you all the instructions, but we're just adding these prescriptions as new prescriptions. The most important thing is give me a print screen of the prescription processing. Just give me a print screen of that. Even if it gets rejected, don't worry about forcing the prescriptions through. Our main goal is to get the right patient, doctor, drug, and SIG code. All right, so let's go to PhilRx. Excuse me, you can pick any doctor. That's fine for us. So all these will be new. So you can just click new prescription. All right, page 170, the top one. Patient name is Cliff, C-L-I. Just type in the first few letters. And it's Fred Donna. Very nice name. Ramon Ramirez is the doctor. I think we used him before. And there he is. All right, what's the drug, everybody? Lasix, L-A-S. Just type in the first few letters and select the correct strength, which is 20 milligrams. And since there is no brand necessary, once the alternative choices pop up, you can just go and use the generic. So the generic for Lasix is furosemide. And just make sure there's an NDC number available. If there's no NDC number, it'll try to find one when you record it, and it'll crash on you. So just make sure there's an NDC number. All right, don't worry about the batch. That's for nursing homes. All right, one refill for this guy. 30 for the quantity prescribed. And since there's no DAW, we can just leave that as 0. 1 daily PRN edema. So T1T space POQDPRN, and I think we'll need to write out edema. Edema, there you go. Take 1 tablet by mouth once daily as needed. Let's do PRNF and then edema. A-D-E-M-A. There you go, that'll be better. T1T POQDPRNF edema. All right, the computer calculates 30-day EDS. Just verify. And so somehow it changed down to 5. So don't worry about it. Leave it as is. I'll just look at the top number and the prescribed EDS. All right, so the most important thing is print screen, save, and then record. So even if it's rejected, don't worry about it. You have your processing screen, and this is the important part. So print screen, save, that's okay, copay, and then record. All right, so that one went through. Let's go on to the next one, page 170 still, now down at the bottom. For this patient, we have 2 drugs. We have nitroglycerin and lisinopril. So we'll just do one at a time to make our lives easier. All right, this time the patient is Horton Mary. There we go, Mary E. Horton, I believe. That's fine. Dr. Abosh. We used Abosh before. So don't worry. These patients, they should all be in there. We shouldn't have to change them. We'll just leave it as is. All right, first drug, NTG. That stands for nitroglycerin. So these are going to be the 0.5 milligram tablets, and they're the sublingual tablets. So I'll try under nitro, N-I-T-R-O. So So we have Nitrobid ointment, patch. We want the nitroglycerin tablets. Alright, there you go. All the way at the bottom. It comes in the brand name Nitrostat. 0.4 milligrams, tablets SL. So the most important thing here, dosage form is your tablet sublingual, and the strength is 0.4 milligrams. So once you find the correct sublingual tablet, 0.4 milligrams, go ahead and select it. Yeah, brand is all we got, so we'll give them the brand. Refills is 2. Quantity is 100. So it says take 1 tablet under the tongue, which is wrong. So we have to do a change. P1T. Place 1 tablet under the tongue. And as needed for chest pain. PRN FCP. See if that goes. No. How about chest pain? Okay, so not too bad. Place 1 tablet under the tongue as needed for chest pain.
What'd you put after chest?
PA for pain. PA, it deciphers as pain. So we'll just give them a 30-day supply. This is like a PRN drug. If they need more, they can actually get more if they need it. So we'll just give them call it a 30-day supply. Alright, so go ahead and print screen this guy. Save and record. As long as you have this print screen, you'll be fine for this lab. Next prescription is on the same prescription pad. Same patient, same doctor as the previous one. This time it's lisinopril 10 milligrams. So go ahead and push new. Same patient. Don't worry about the address. This time lisinopril, L-I-S-I. And we want the lisinopril?
I didn't notice that there was 2 prescriptions for that one patient.
Oh yeah. $10 milligrams. So it looks like we have a DUR, nitrates, nitroglycerins. So let's go ahead and we'll close it. So it's just saying that it might even lower your blood pressure even more. So be careful on this one. I only got one with an NDC number. So make sure you select a drug with an NDC number. Two refills, 30 tablets. And this time it's T1T POQD. T1T POQD. Take 1 tablet by mouth once daily. And then the EDS is 30. So go ahead and print screen before you save and record.
Sums up with this program and just keeps entering information that I'm not putting in. Same with yours, huh? 7 and 5.
Yeah, it's reducing the insurance payment amount. We won't mess around with it. Save, record. Alright, not too bad. So we're ready for page 171, top prescription. So it has 2 drugs again. We have Ventolin, the inhaler. So we know the amount of puffs per inhaler from previous classes. We researched that information. And then that second drug is Zyrtec. So again, new. This time the patient is Hatcher. Ernest. All right, only one guy. Doctor is, so the address isn't the same, but we won't change it. We'll just leave it as is. Same Dr. Abosh. First drug, Ventolin. So no brand or generic, so we can give them generic. And make sure it is the inhaler, and it's going to be 2 inhalers. So Ventolin, there you go. There's the inhaler. We got the 18-gram package and then the 8-gram package. So if they're outpatient, we give them 18 grams. If they're inpatient, we give them 8 grams. So this patient is an outpatient, so we'll give them the big container, 18-gram container. All right, so no brand or generic consideration, so we can give them the generic. So G for generic, Albuterol. Obsolete. All right. Sounds it. All right. So refills ordered is 0. Each container is 18 grams, but the doctor says pound 2. So we got to give them twice as much, which would be 36 grams. So 2 containers we bill per gram in pharmacy. So that's where we come up with the quantity 36. Each container is 18 grams, noted here down at the bottom. The doctor says give them 2, so we dispense 36 grams worth. So if you bill only for 2, that means you only billed for 2 grams. I'd come back to your pharmacy. Really good pricing. All right, let's see the SIG. I2P, inhale 2 puffs by mouth, PO. Q3 to 4H PRN. Q3-4H PRN. All right, sounds good. I2P PO Q3-4H PRN. Inhale 2 puffs by mouth every 3 to 4 hours as needed. All right, so each inhaler gives us 200 puffs. We have 2 inhalers, so that is 400 puffs. This patient can take up to 2 puffs 8 times a day for a total of 16. So take your calculator.
Quick question, sorry. Just curious, where do we document 2 Ventolins? We're documenting 2, we're giving them 2?
In the grams. So each container is 18 grams. So if we give them 2 containers, that'll be 36 grams. That's 36.
It's 22 days.
All right, so we got 400 puffs in the 2 containers. Divide by 2 up to 8 times a day. That's 16. And you said 20,
Oh, wait, I think I did that.
25?
25,
So EDS should be about 25 for that guy.
I did it divided by 18.
All right, print screen. That's the important one, is this one. Save and record. So Ventolin, 2 containers, 36 grams, 400 puffs for EDS. I2P POQ 3-4H PRN. So the next drug, we'll save and record, and then we'll do the same patient, same doctor. Hatcher, Abosh. This time we have Zyrtec. We don't want Zyrtec D, we just want regular Zyrtec. So let's try ZY. What comes up? because that contains Sudafed. So we'll have to look under the generic name. So here, a little cheat, the generic name's right here. We don't want the Sudafed, we just want the sertraline by itself. The D stands for the decongestant Sudafed. So a little tricky, so we'll just look under sertraline. CETI. And we want the 10 milligram tablets. Not the chewable, but just the regular tablets. Yep, sertraline, 10 milligrams, regular tablets, 0 refills, give them 30. And then this one is T1T POQD. Take 1 tablet by mouth once daily. EDS is 30. All right, go ahead and print screen before you save and record. Bottom of page 171, we already did that in a previous lab. Glucophage, folic acid, Inderol, and the Xyloprim. We already did that last week. So let's skip those 4. Let's go on to page 172. 172, we have some Albuterol Ampules this time. So last time we had the inhaler. This time they're little ampules, 3 ml ampules for nebulizer use. All right, let's enter him in. Mr. Ellis, Dr. Samuel Adams. What a patriot. Adams, A-D-A. Adams, Samuel Adams. Albuterol. A-L-B. We want the 2.5 milligrams per 3.
Who's the first one?
Oh, there it is, yeah. So it's in the strength column here. 2.5 per 3. The strength here in the title just broke it down per 1 milligram. All right, we'll select that guy. A little more serious, so it's in red. Serious interaction found, beta blockers, propanolol. More, okay, we'll just go ahead and skip it for now. All right, so we got the correct ampules. No refills. Now we got to figure out how many of these ampules they will need. So it's 2.5 every 3 hours.
Would it be every 8 hours? Because it's 3 doses.
Every 3 doses. Huh. Yeah, okay. Then 5 every 4 hours. Let's give them just a day's supply. 2 days supply. So 2.5 milligrams. Let's do that 3 doses. So let's do 3 doses of 2.5. And then if it's every 4 hours, that would be 6 doses, right? All right, let's count out the milligrams. So 3 doses of 2.5, that's going to be 9 mLs. All right, so that's the first part. And in the second regiment, it's 6 mLs 6 times for 36. So it's 36 plus 9. 45 mLs. So each container is 3 mLs. Looks like they'll need 15. 3 for the first day, and then they will need 12 for the subsequent day. All right. So we'll do it that way. Just 2 days worth. Use in nebulizer as directed. Let's keep it as that. We'll keep it safe. We'll just do a 2-day supply for that guy. All right, print screen him. Save. And then record. This one says paid, so we're good. You don't have to have a print screen of that. Down to the bottom of the page, 172. We got 3 drugs for this patient: Prilosec, Ambient, and Flomax. All right, this patient is Richard Douglas. Doctor is Gaffney. Joseph. All right, not too bad. First drug, Prilosec. So no brand or generic, so we'll try to give them generic. Prilosec 30s. Are there any 30s available? Uh-oh. How does that happen? Let's go ahead and give them 3 of the 10s? That's not going to work. So they don't come 30s. Let's look at the generic. See if the generic comes 30. Okay, omeprazole does not. All right, so we're going to have to give them 3 of the 30s. So we're going to have to change it a little bit. So the doctor asked for 30 milligrams. They don't come 30. They only come 10s. So in order to give the doctor what he wants, we're going to have to tell him to do 3 a day. So we'll change that to 90. T3C space POQD. QD. There you go. Take 3 capsules by mouth once daily. So in order to get the 30 milligram dose, we got to give them the 10 milligram capsules. 3 a day for 30 days. EDS is 30. So you guys can print screen this. To save you guys some time, let's try the Save Plus button. So if you use the Save Plus button, it just starts with the same patient and doctor. That way you can just go straight to the drug name. Second drug is Ambient. AMB. And we want the 5 milligram. Generics available. Zolpidem, so we'll give them that. 15 only. So this is take 1, so let's do T1T space POQHS. Take 1 tablet by mouth every night at bedtime. So EDS is 15. All right, print screen this guy. And then you can use the Save Plus button again to save the same patient and doctor. Third drug, Flomax. 0.4. We can give them the generic, that's fine. Tamalucin, 0.4 milligram capsules. No refills, quantity is 30. We'll give them 30. Take 1 capsule by mouth. Oh, nope, this is every day with meals. So we'll have to change it. T1C POQD with meals. CM, yeah, that works. CM works. I think WM works as well. Yep, CM or CM with meals. All right, this time, since it's the last one for this patient, just push the save button, not the save plus. So go ahead and print screen. Now you just push the save button once, and you'll do all your recording. Paid, very nice. Paid, very nice. And paid again.
Man, what was after the 5 mils? You said with meals?
CM?
CM?
POCM?
With meals, yeah. With. All right, let's go ahead and take a little break, and we'll come back and we'll finish this guy up. All right, let's continue on page 173. So next patient is Romanoff. Natasha. All right, don't worry about the HIPAA. We'll continue. Doctor is Gaffney again. Drug is Adderall. So it's the extended release form. But the doctor didn't really specify what strength. Alright, so you'll have to call. Let's give them the 10. All right, yeah, 10's low. We could have gave him 30, but
I was going to say 5.
we'll give him the 10 XR. So we'll just pretend we called the doctor. Doctor called back. What do you got? All right, so brand generic, nothing indicated. So dextroamphetamine and amphetamine salts without the carbon. No carbon. So no refills. It's a C2. We'll give him 30. And it's just one every day. So T1C, POQD. Take 1 capsule by mouth once daily. EDS is 30. Give me a print screen before you save and record. All right, moving to the bottom of the page. This time we have nitroglycerin ointment. So for us, 1 inch is going to be about 1 gram of supply. And the doctor says to apply 1 inch to chest. All right, this patient is Zin. Harry or Carrie? This is Harry. And the doctor is Wilson. Harold. All right, drug nitroglycerin. NITRO. And we want the ointment. 2%. So we have it under brand name Nitrobid. Let's see if it has under nitroglycerin 2%. No, it's under the brand name, so there probably is going to be a generic version. Let's give them the 30-gram tube. Yeah, we'll just give them 1 tube for now. So give them the 30-gram tube, Nitrobid, 2%. Yeah, give them the 30. The 60 doesn't have an NDC, so give them the 30. No refills for this one. So apply 1 inch to chest every 8 hours. AP 1 inch to chest. Apply 1 inch to chest. Q8H. Q8H. So we'll assume 1 gram per inch. So they use up to 3 inches in a day. So that's 3 grams. So 30 divided by 3, their EDS would be 10 for this one. So recap for nitrobid, 1 inch is equal to 1 gram. Just give them the 30 gram too for now. All right, save and record. Page 174. All right, we got some S/S. We'll make them swish and swallow, both of them. So the top one is nystatin, common for fungal infection. Patient is York, Myrtle, and doctor is Wilson Harold again. All right, drug is nystatin. So it's going to come in units per ml. Most likely it's 100,000 units. All right, nystatin. We got some powders. We got ointments. We want the suspension. All right, we got to give them enough for a 10-day supply. So let's just pick the correct drug first. So let's pick the bulk bottle. Nystatin, 100,000 units per ml. Yeah, we'll select the pint. Because they'll need at least 400 mLs for the 10 days. So 475, we'll give them the whole bottle. So it's going to be S/S. Does that work? SS? No. Let's look in the page 15 or Roman numeral 15. Let's see if they have anything for swish and swallow or swish and spit out.
I'm just paying for the what is it that I'm trying to say here? For the package size.
No.
Nystatin.
473.
Determine that.
You're gonna use 5 mLs 4 times a day for 10 days. So 5 times 4 times 10 would be what is that, 200? So we'll just give them the whole bottle.
Wait, so you said a pint?
Yeah. Give
Would
'em-
the pint be the 480?
That's our approximation. The exact is 473. Oh, do they have one? Yeah, 1 refill. We got 1. Swish and swallow. 1 TSP. Swish and swallow. Nope, can't do 1 TSP. There's that take in there right away. What the heck? Alright, so can't do. So we'll just have to do 1 space TSP. Swish and swallow 1 space TSP. Swish and swallow 1 teaspoonful by mouth 4 times a day. QID F10. F10 for 10 days. Swish and swallow 1 TSP PO QID F10 for 10 days. EDS is already given to us. What's the EDS? 10 days. Alright, we'll just give it to them as is. We won't worry about decanting this one. Alright, so print screen this guy. Save. Don't worry about the batch. And record. This guy's paid. Nice. Alright, down at the bottom of page 174, we have two drugs, Keflex and lidocaine viscous, another swish and swallow. So let's do new. This time the patient is Yost. Y-O-S-T.
I have a question.
Yeah.
So I hit the 480, and I was trying to go back and change it, and then the prescribed quantity is now at 0, and I can't put in 473.
Don't press escape. It'll erase everything.
Yeah,
I
go.
didn't escape, I just hit tab and enter.
Yeah, let me take a look real quick.
And it says enter prescribed quantity.
Whenever that happens to me, I just press enter, or I'll enter some false information, and I'll go back to that category.
Oh,
and change
never mind.
it.
Never mind. Sorry. I had the number locked. My bad.
Yeah, sometimes if you go too far, it'll make you enter stuff. Alright, down at the bottom, page 174. So the first one is Keflex. Just the 500 milligram Polvo. They're just capsules. It's just their proprietary name. So no brand or generic indicated. We can give them Cephalexin as the generic. Refills is 0. Quantity, well, we're gonna have to figure it out. 1 tablet. Nope, they're capsules, so that's wrong. So it's 1 capsule every 6 hours for 10 days. So they would need 40, right? T1C PO Q6HF10. Take 1 capsule by mouth every 6 hours for 10 days. And then the EDS, yeah, it should be 10. Print screen this guy. And then you just click the save plus since it's the same patient. And we'll go on to the lidocaine.
It says T1C.
Yeah, T1C PO Q6HF10. Alright. So lidocaine viscous, that's the only one that shows up, the 2% oral solution. The bottle already comes in 100 mLs down here, and the doctor says pound C, so the quantity prescribed is already indicated. So we don't have to change any of those numbers if you select the 100 ml package. Swish and swallow. One space TSP, PO. I guess that's it every day.
Is that half of 1 teaspoon?
S/S, swish and swallow.
I'm sorry. What package size did you pick for lidocaine?
Lidocaine, the 100.
Okay.
The 100. Pound C. So the pound C is for pound 100. So swish and swallow, 1 TSP PO QD. 100, 5 a day. That should last them 20 days. And the computer calculated 20, so that's good. All right, print screen this. Now you can just go ahead and push the save 1. And then when you record, it will record both your prescriptions. Page 175. So the top one, couple drugs. Visceral and metformin for Dorothy Zucker. Z-U-C. Dorothy, there you go. No Berg, it's just Zucker. Doctor is Unger. James. Drug Vistaril. and they want the 25 milligrams. No brand or generic indicated, so we can give them generic. Hydroxyzine. Refill 0. XXX is 30 to be dispensed. And it's going to be 1 QID PRN anxiety. So T1T space POQID space PRN anxiety. What's that? T1C? Are they capsules? T1C. T1C. T1C POQID PRNF, and it's just anxiety. $30 divided by 4, so they rounded up. Let's round down to 7. 7-day supply. Print screen, and then we can use Save Plus since the patient has also metformin. Glucophage 500. We can give them the generic metformin. No refills. 90 this time for the quantity. And it's TID-AC. So T1T POTID-AC. Take 1 tablet by mouth 3 times a day before meals. So that should last them not 10 days. That should last them 30 days, right? 30 days. That's more like it. Take 1 tablet by mouth 3 times a day before meals. Yeah, EDS should be 30. Now that they're both in there, you can just put the save one and record. Bottom of page 175, we have a liquid medication, 8 ounces worth. Donatol liquid for Finnegan Sean. Doctor is Alexander. Carey. Donatol elixir, 8 ounces. So 8 ounces is 120 or exactly 118. So either one is fine. All right, we can go generic. Oh, can't. Let me go back here. That's not it. It should be 8 ounces. Should be 240. 8 ounces, right?
Oh, 1 refill.
Or 1 refill. 1 refill. And it should be 8 ounces, which is 240. There you go. Sounds better. All right, Donatol. 8 ounces. So give them this one. We'll give them 2 packages for 240. And they're going to take 1 to 2 teaspoons full by mouth with 30 mLs of Malox as needed. So T1-2 TSP. No, that doesn't work. We'll put some spaces. Take 1, 2 teaspoons. Doesn't work. All right. Take 1 to 2 teaspoons full by mouth. And we'll just type out the rest of it. With 30 mLs of Malox PRN. With 30 mLs Maalox. Purine. Take 1 to 2 teaspoons full by mouth with 30 ml Maalox as needed. So 1 to 2, 10. So just give them, so PRN, so we don't know how much they'll need it. It's up to 4 times a day. So up to 10, so up to 40. Up to 40 mLs a day. EDS should just be about 6. Alright, print screen. Save and record that guy. And let's go on to the last page. So we got 1, 2, 3, 4 more prescriptions. And then you guys are done for all your labs for week 2. You only have your midterm. Timolol. So we got an eye drop and we got some Synthroid as well. Same patient, Finnegan. Sean. Alexander Carey. Timolol. So 0.5% strength Timoptic. So some eye drops. So 0.5% is 0.5. Yeah, it looks like there's a 5 ml bottle, but there's no NDC.
10 ml bottle with an NDC.
Yeah, let's give him the 10 ml bottle. And yeah, that's
3 refills.
yeah, 10 ml bottles. 3. Instill 1 drop into each eye twice a day. So we'll I1G
4 drops a day.
OU, still 1 drop into both eyes BID. Alright, so our approximation is 20 drops per ml. So if we give them a 10 ml bottle times 20, each bottle would give us 200 drops, and they use 4 drops a day. Yep, 4 drops a day. So your EDS will be 50 days. So they calculated just 1 eye, but OU would be 50 days. There you go. Alright, we can just save plus since there's another drug. Same patient, same doctor. This time it's Synthroid, SYNTH. And we want the 50 micrograms. 50 mcg tablet. No brand or generic indicated. Let's see, minor interaction. We can go ahead and override this.
Where on the prescription would they indicate brand or generic?
It'll just say brand
Would it have
necessary.
like a little check or something? I'm assuming,
For these labs so far, they just say brand necessary on them.
Okay.
3 refills. Quantity, 30-day supply, we're assuming. So T1T POQD. 30-day supply. Print screen. This time we can just save 1 and record. Alright, for the last one, we got 2 drugs. The prednisone, we're just going to dispense 1 month worth. No refills. And then the aprazolam, we'll give them 3 refills. Alright, new. This time the patient is good. Bernice. Doctor is Alexander again. Carrie. Drug is prednisone. So this one, there is no refills because it'll be truncated. So we need prednisone, 200 milligrams per day for 7 days, then 100 milligrams every day, dispense 1 month. So what strength would be the best strength to dispense?
Highest one I see is 50.
So yeah, we're gonna have to give them the 50 milligram tablets.
That one's also missing a package size.
Package size doesn't matter. We have to figure out how much to give them. The EDS is given to us. EDS is 30 days, right? Dispense 1 month. So we have to QS. We have to figure out how many tablets to give this patient. So let's do prednisone 50. This one, no refills because it'll be truncated. All right, so we got to figure out how many to give them. So we're doing 4 a day for 7 days, right? To get 200, you need 4 tablets for 7 days. So that is how many tablets? 28?
Yeah.
Then you'll need 2 tablets every other day. Well, this isn't fun, right? So let's say we got 24 days left. Yeah, let's say we got 24 days left. Of those 24 days, we're only going to give it to them on 12 of those days, right? So on 12 of those days, we'll give them 2 tablets. So that's another 24. So the initial was 28 plus 24 for a total of 52. So that one you just have to figure out. And you would not refill this because you'd tell them to go back to 4 tablets a day. That would be wrong. Okay, so this one, no refills. So T, 4 T P O Q D F7 or F1 or F7. Let's do F7, comma. All right, no comma. Then every other day. Then 2T Q O D. 30-day supply. Take 4 tablets by mouth once daily for 7 days, then 2 tablets every other day. We already figured out EDS 30 days. Technically it's 31 day supply, but we'll just call it 30. Right. We can save plus on this one. They have 1 more drug. There's Xanax. Same doctor, same patient. This drug is Albuterol ALPR. And we want the 0.1 milligram. Do they want 1 milligram or 0.1 milligram? I think it's supposed to be 1 milligram. There's no such thing as 0.1. So let's give them 1 milligram. And it looks like it's just regular tablets. So don't give them the ODT. Give them just the regular 1 milligram tablet. Albuterol 1 milligram, generic is fine. There's an NDC number. This time we'll give them the 3 refills. 50. And the SIG is TID PRN anxiety. T1T POTID PRN F anxiety. $53 times a day, yeah, about 16 days, 17 days. And that's it. Print screen this guy, save, record, and you're done for the comprehensive retail pharmacy practice.